My name is Diana Rosario, and this is my dental emergence case study project about adrenal crisis. My friends Jane and Liz helped me to develop the video. Adrenal glands are endocrine glands located on the top of the kidneys, and they are responsible by the production of some important hormones. Each gland consists of two parts. Middle, each produce epinephrine and norepinephrine, and the cortex, responsible for the production of cortisol and aldosterone. Cortisol is an steroid hormone that regulates some vital processes to the body, including metabolism and immune response. Cortisol also helps the body to provide a response to the stress. Aldosterone regulates salt and water levels, which affect blood volume and blood pressure. Adrenal insufficiency can be divided in two groups. Primary adrenal insufficiency, also called Addison disease, indicates the destruction of adrenal cortex, part of adrenal gland. Common causes of this form of adrenal insufficiency are autoimmune disease, tuberculosis, adrenal metastasis, and AIDS. And the secondary form of adrenal insufficiency is the lack of production of adrenocorticotropic hormone, used to stimulate the adrenal cortex. It recommends the replacement of glucocorticoids and mineralocorticoids to treat both types of adrenal insufficiency. I started review the patient medical history and realized that she has suffered from Addison disease. I asked the patient how she's feeling today. She states she's feeling okay, but have a big feeling abdominal pain for the rest of the week. I asked the patient if she would like to reschedule the appointment for another day when she feels better, but she says she's feeling okay to continue the procedure. Then I moved to the next step to check her vitals. Her blood pressure reading is 108/58, which indicates a little low of the normal, but not an alarming situation. So we continue the treatment. 30 minutes later, my patient asked me to stop and complains of she's not feeling well. She said that she's feeling headache, nauseous, and very weak. At this point, I suspect that my patient may be experiencing an adrenal crisis. Then I asked if she's feeling any other symptoms, and she said that the abdominal pain become stronger. I take notes of the time that symptom started, and then I decide to retake her vital to see if anything changed. Her blood pressure now indicates 100/48, almost 10 points below of the first reading. This is confirmed to me that my patient is having an adrenal crisis. So I asked somebody to immediately call 911. I put the patient in supine position and monitor her vitals until the EMS arrived. As the patient did not present sign of dyspnea, it was not necessary to administer oxygen. Adrenal crisis is a medical emergency caused by the lack of cortisol. This condition can happen in one of two ways. Patient has not been diagnosed with adrenal insufficiency, or patient with adrenal insufficiency is experiencing a stressful situation where the body needs additional cortisol but is unable to produce the necessary amount. Adrenal crisis can present some symptoms such as fatigue, lethargy, muscular weakness, headache, confusion, fever, nausea, vomiting, abdominal pain, hypotension, tachycardia, diaphoresis, dehydration, cyanosis, sunken eyes, dyspnea, dizziness, and somnolence. Treatment for adrenal crisis are followed by some steps, such as recognize signs and symptoms of adrenal crisis, evaluate the level of consciousness, put the patient in supine position and keep airway, activate CPR if necessary, provide 2 to 5 liters per minute of oxygen via nasal cannula if the patient is experiencing dyspnea. Corticosteroids need to be provided by the EMS. There are some measures to prevent adrenal crisis, among them take corticosteroids regularly, avoid stressful situations, and wear a bracelet or carry an emergency card that indicates the diagnosis, medications, doses, and the physician names to call in case of adrenal crisis emergency.